So it is indeed an honor for me to introduce today's speaker. I'm a big fan of his, not only for his business acumen and success, but also for what he and the company he leads do in the community and for our state. Tim Vine serves as the President and Chief Executive Officer of Blue Cross Blue Shield of Alabama, the largest provider of healthcare benefits in Alabama, serving nearly 3 million members, of which 2 million reside in the state. Tim started at Blue Cross Blue Shield in 1994, and since then he's held roles of increasing responsibility. He served in his current position as President and CEO since April 2018. And not only does he do that, but he also serves as the chairman of the board for the Blue Cross Blue Shield Association. He's active in a number of other key leadership roles, including the board of directors of Regions Financial Corporation, the board of trustees of Auburn, and the board of trustees for Samford University. He also serves on the board of the Birmingham Business Alliance, Leadership Birmingham, Business Council of Alabama, Economic Development Partnership of Alabama, and Prosper. And he is also a member of the Alabama Academy of Honor. He is indeed a busy man. Please join me in welcoming Tim Vine as he makes his way to the podium.
Good afternoon, and thank you for the opportunity, JW, to speak to the Kiwanis Club. And thank you, Scott, for that very generous introduction. My job today is to, one, stay on time, as JW has warned me that he will give me the hook if I go overtime. But two, just to give you an opportunity to learn a little bit more about our company, Blue Cross and Blue Shield of Alabama, and the wonderful things that we do there and our associates do there. And we are privileged and blessed to serve this community and our state. So who are we? We started in 1936 as the Hospital Service Corporation. So Blue Cross Blue Shield was started by the hospitals in the state, which is an interesting dynamic. And hospital coverage back then could be purchased for 75 cents a month or $9 a year. So it was just an interesting dynamic back then. I think as the hospital administrators say, we've got to figure out a way to support payment for coverage. So insurance was started then. We are a private, non-stock, not-for-profit healthcare service corporation. In essence, what that means is we are not publicly traded. We are a private, not-for-profit organization. We are governed by our board of directors. We have 27 board members, 6 of which are hospital administrators, 6 are physicians, 14 are public members, and I also serve on the board of directors as well. People are, some folks who do not know are amazed that we have hospital administrators and physicians on our board. We have a great partnership with our hospital administrators and our physicians throughout the state. That is critically important to our success, and we will continue to have that as part of our organization. We are regulated by the State Department of Insurance and the Insurance Commissioner. We also are a government contractor, so CMS regulates us as well. We have over 4,400 associates. We are headquartered in River Chase in Hoover. Although we do have major offices in the major cities, we have district sales offices in Huntsville and Montgomery and Mobile and Birmingham, and we have satellite offices throughout the state. As Scott mentioned, we cover almost 3 million members, 2 million of which are located in the state of Alabama. And we have gross revenues approaching $17 billion. We are one of 34 Blue Cross Blue Shield plans located throughout the country. So we are an independent licensee of the Blue Cross Blue Shield Association. The Blue Cross Blue Shield Association in Chicago owns the name and mark, and they allow the 34 independent plans to use that name and mark throughout the country. The collective Blue system covers 118 million members. So the Blues collectively cover 1 in 3 Americans. We are the 10th largest Blue Cross Blue Shield plan in core membership, and we are a single state Blue Cross Blue Shield plan. There's some other plans that have service areas in multiple states, but we are a single state Blue Cross Blue Shield plan. And we have one of the lowest administrative expense ratios in the entire Blue system. Now, a trend that's happening in healthcare, not only in the payer space, but this slide will illustrate it. In 1950, there were 155 Blue Cross Blue Shield plans. In 2023 and currently in 2023, there are 34. There has been consolidation in the health insurance space, just as there is currently consolidation in the hospital space and the physician space as well. It is an interesting dynamic that's happening in the market. We have health insurance that owns PBMs, or pharmacy benefit managers. We have pharmacy benefit managers that own health insurance companies. We have physician practices that are being bought by private equity. There's an interesting trend that's happening in healthcare where consolidation is happening not only on the payer side, but it's happening on the provider side as well. Just an interesting dynamic on our contribution to the state and federal. We paid our healthcare providers in the state in 2022 a little bit over almost $11 billion. We paid $150 million, a little bit more than that, in local, state, and federal taxes, including ACA assessments paid in 2022. And over the last 5 years, we have contributed almost $300 million to the Alabama premium tax that's paid to the state. So some misnomers are we do not pay taxes. We do pay taxes, and we pay quite a bit of taxes. So just wanted to let you know how the organization runs and how that process goes. So what do we do? Our mission is to provide employers, families, individuals access to quality, affordable health care because we truly care about their financial security, health, and peace of mind. This mission guides everything that we do every single day at our company, and it's critically important that our associates understand why we're here and why we do what we do. We handle almost 215,000 claims a day, 77 million a year. We do them accurately and timely. We handle 17,000 calls a day, over 4.5 million interactions with our customers. Behind every single statistic here, we recognize that there's a customer behind that. And it is critically important for us to provide an excellent customer experience, whether those are our members or our provider partners. It is critically important for us to provide them with an excellent experience every single day. We cover nearly 20,000 local and national employer groups. That is critically important to our success. We do not take that for granted. Every year, our customers have an opportunity to select a different carrier if they so choose. So we have to earn that business every single year with every interaction we have with all of our customer groups. We have members in all 50 states. If you look at the map, the darker the state, the more members we have concentrated in those states. But we literally have members in all 50 states. We are headquartered in Alabama, but we have customer groups that we have had relationships for many, many years that are located outside of the state, which equates to membership in all 50 states. Here's some of our large national customers. You will recognize some of the names of the customers on this list. About 35% of our total membership is comprised in large self-funded companies. And our average tenure of our national accounts is 24 years, is the average tenure. Critically important to our success, critically important to our continued success. And one thing we cannot take for granted because the competition is getting steep. It continues to get, our competitors continue to be more innovative, and we have to continue to be innovative as well in service to our customers. We offer our products along the healthcare space, whether it's health or pharmacy or dental or behavioral health or vision, anything you can imagine from a healthcare delivery perspective, we have products in that space. And it's critically important for our continued success that we continue to innovate with our product and our product offerings so that our customers can continue to offer their employees healthcare services. We retain 93% of our groups and have done that over the last 2 decades. That is not a small feat because we have our customers that are doing market checks every year to ensure that they are getting the best products, the best services for the best cost. And we recognize that as a continued opportunity for us in service to our customers And that is not something we take for granted in service to our customers. So if you're looking at the healthcare dollar, about 1.5 cents of every healthcare dollar that we have received over the last few years kind of goes to the bottom line. We have one of the lowest administrative expense ratios in the entire country of any Blue Plan or any of our competitors. But if you were breaking out the dollar by how do we pay providers and what percent goes to what provider class, a little over 43 cents of every dollar goes to hospitals. A little bit over 34 cents of every dollar goes to professionals, physicians, DME, PT, all in that category, chiropractors. And 22.6% go to the pharmacy space. And we're going to talk about pharmacy in just a second when we talk about some of the recent trends in healthcare and where healthcare costs are going. So as we talk about trends in healthcare, just to talk about prescription drugs and pharmacy for just a minute, generic drugs make up almost 87% of all the drugs dispensed. Brand name drugs make up almost 13% of all drugs dispensed in our book of business. And specialty drugs account for 0.8% of the drugs that are dispensed in our population, but they represent almost 46% of the overall cost. You can see 86% represents 8.5% of the dollar. The 12.6% represents a little bit over 45%, but the 0.8% of specialty drugs represents almost 6% of the overall cost from a pharmacy perspective. There are some amazing curative therapies that are being created for our members to experience with their healthcare conditions. Some of them are extremely expensive. If you were to look at our business and the highest cost drugs in the specialty category, I think Humira was probably the top expense drug in our entire category for a period of time. But you can see inflammatory conditions, cystic fibrosis, those categories of drugs represent, from a retail prescription drug specialty perspective, the highest cost in our book of business. Now, there are biologic drugs and there are biosimilar drugs. Some biosimilar drugs that are coming on the market come at a cost reduction of 15 to 35%. But there are patents on some of those drugs. Some of those patents are running off. And there are some opportunities to shift that dynamic a little bit. But we want to make sure that our members are getting the appropriate care that they need with the drugs that they need to treat their specific condition. Now, the next slide is going to demonstrate some of the, when you talk about cell and gene therapy drugs, I want to give you a sense of some of the drugs that are on the market and the cost for one infusion of those drugs. Let's take Zolgensma, which for children less than 2 years old that are dealing with spinal muscular atrophy, any parent would want their kid to get the best treatment so that they could be successful in life. Any of us, me included, and we cover these drugs. One dose of that drug costs from $2.1 to $2.3 million. But for a child, you say, what's the price of life for a child? Sometimes those drugs work, sometimes they don't. It is just an interesting dynamic. Let's go down the list. Hemgenix, which is a drug that treats hemophilia B. That drug came on the market with a one-time infusion price tag of $4 million. We were seeing some of these drugs, and you can just go down the list. There are probably 10 of those drugs now. At the end of 2024, there are probably going to be 20 to almost 30 of those drugs on the market, treating different types of conditions. Some of these are rare disease conditions, And some of these are amazing, absolutely amazing therapies. But this is part of the trend we're seeing in healthcare in terms of gene and cell therapy and specialty drugs and the overall cost in the market, which are just some interesting dynamics. And we're trying to weigh how do you justify that cost based on the treatment regimen and the like. So it's an interesting dynamic now that we are, on behalf of our customers, trying to manage these drugs, their cost and condition. Some of our customers are telling us, I will not pay for that drug because it is absolutely too expensive and it will bankrupt my company. So we're balancing the clinical efficacy of those drugs based on the financial results and the like. So it's an interesting dynamic that we are managing every single day on behalf of our customers to ensure that our members are getting the absolute best treatment possible. We, the Collective Blues, have invested in a company that now are manufacturing drugs. You say, so you've got a health insurance payer that's invested in a company that's manufacturing drugs. And we're doing that to help with the overall cost dynamic in this space, specifically for drugs that fall into a certain category. So our first drug is on the market that's used to treat prostate cancer. The generic cost of the current drugs on the market were $19 per tablet. The cost of the drug that we were able to generate and complete cost $2 per tablet. So we're trying to address the overall cost of drugs while providing the therapies that are needed by our customers and our members in the market. We will have an insulin drug that will be coming out in 2025. And the cost of that drug will be pennies compared to the current cost of insulin on the market as well. We see this as part of our responsibility to ensure that we are helping our customers address the overall cost of pharmaceutical drugs in the market as well. In terms of overall expenditures and comparativeness of our state healthcare costs compared to others, we have some of the lowest costs in the country. Individual premiums in Alabama, they are the fourth lowest in the country behind Oklahoma, Mississippi, and Utah. And from family premiums, we're fourth lowest as well behind Oklahoma, Kansas, and Arkansas. There have been years in the past where we have been first in terms of lowest cost premiums in the country, but we are currently fourth. We are proud of that. We're providing value for our customers, but we want to make sure that we are ensuring that our members get access to quality, affordable health care because, quite frankly, they deserve the absolute best. So who are we? We call ourselves a caring company. We have called ourselves a caring company for many, many years because our corporate values are we respect our customers, we give back to our community. That is critically important to who we are as a company. We take that responsibility very, very seriously. And I see one of our partners in the room. We're going to talk about United Way in just a second. But through our charitable foundation, last year, we contributed almost $12 million to 559 different charitable organizations. United Way is huge in our company, absolutely huge. 100% of our associates give to United Way, 100%. Our employees contributed a little bit over $4 million to the campaign this past year. And our executive vice president is the current chair of the campaign for this year. So United Way has been instrumental to our company for many, many years. In terms of corporate contributions, I'm looking at my friends from Regions. We kind of vacillate back and forth in terms of the company that contributes most to the United Way campaign. I think this past year they nipped us out. I think the year before we were first, but we love that type of competition because who benefits from that? It is the members in our society and in our community with the overall corporate contributions to United Way. We are all about, through our charitable foundation, contributing to organizations that address health, wellness, fitness, and education. We have started a process of creating fitness centers throughout the state. You will see some of the cities where we have added fitness centers. We've added 12 thus far. Probably by the end of the year, we may have 20 of these located throughout the state. It's critically important for us in terms of giving back to the community and these fitness centers in partnership with the cities that are represented. They are thrilled to have these as options in their state in terms of addressing the overall healthcare and health and fitness of their citizens. So the Kids Mercedes Marathon, how many in this room have either participated in the Mercedes Marathon or your kids have participated in the Kids Marathon? Raise your hand. Quite a bit in the room. I see Keith Andrus. I can remember the years that I was doing the half marathons. I think I did them for 12 or 13 years until my knees gave out on me, but Keith would always be ahead of me every race. So we know that the Mercedes Marathon is ending downtown, but we got approached by parents who said, please, and we've been the sponsor of the Kids Mercedes Marathon since 2012. The parents said, please do not let that go. So we have partnered with the city of Hoover, and we will be offering the Blue Cross Blue Shield Kids Marathon in Hoover. That will be February 24th. This will be the largest kids marathon in the nation. And we are proud to be partnering with the city of Hoover to continue that. There are kids, and parents said, there are kids that have gotten into track and field, and some who are competing on track and field teams in college because they learned these things running the kids Mercedes and Blue Cross Marathon. So it was very critical for us to continue that effort, and we're looking forward to continuing that for many, many years to come. We have a Be Healthy School Grant Program. Childhood obesity is a huge issue, not only in our state, in multiple states, but within our population. So we have had for many, many years, and here's a shameless plug for your husband, Jeff. Jeff ran this program at our company for many, many years. And we have contributed to schools in multiple different counties all over the state. Schools can apply for grants of up to $10,000. They have to be for health, wellness, and fitness and education efforts. This is a program we are very, very proud of. You can see the stars of all the schools and the counties where we have supported this effort. We've granted over $2.9 million, 320 grants, affected a little bit over 150,000 kids. We only have, I think, 2 or 3 counties that have not applied for a grant. So if you're in Clay County or Choctaw, and I think there's one other, if you know anybody from those counties, please send them our way. We really want those counties to participate. This has been a great program for us. The schools love participating in these programs, and they can apply for a grant of up to $10,000 per year, and we are there and willing to help. As I get to a point of close, I want to mention one other program that we are very, very proud of. That is our medical school scholarship program. Alabama is deemed a medically underserved state, and it is critically important for us to provide primary care, to assist in providing primary care throughout the state. So we're partnered with all 4 medical schools within the state: ACOM in Dothan, UAB School of Medicine, VCOM in Auburn, and the USA Medical School. We will pay for the last 2 years of medical school for students and practitioners who will agree to serve 3 years in an underserved area. We'll help them get their practice started. We'll help them with medical malpractice insurance. It is critically important for us to invest back in the community, and we are now seeing the fruits of our labor. We have 29 physicians that are practicing in rural areas of the state. We hope that over the next 10 years, that number will be 150 up to 200 physicians that are practicing across the state. This is critically important to our mission as a company and who we are as an organization. And we are about to re-up these grants and to provide additional funding for the medical schools. And we look forward to the partnership that we'll have down through the year. And we're going to close with a video of an individual that will be sharing her experience of what one of these medical school grants have done for her.
I'm proud of its growth. Welcome to Enterprise, a progressive town in South Alabama, right in the center of Wiregrass Country.
People love to come here. They want to live here. We're not a large city, so to speak, but we're big at heart.
Originally from a small rural South Alabama town herself, Dr. Whitney Richard recently made Enterprise her home to raise her family and to open up her own medical practice where more primary care doctors are needed in a growing area.
When I moved to Enterprise, I didn't think that, just one new doctor could make that much of a difference. It's a very small town. Maybe there aren't that many people who need a new doctor. Are there going to be a lot of new patients that need to come to see me? And what I found out is that there are still tons of patients that don't have a primary care physician and still need one. And so it's really important to me and meaningful to me that I'm able to provide that care for that gap in care. It's just really important that we have enough physicians to support not only the people of the small town of Enterprise, but the even smaller towns that surround Enterprise.
All right, quick look. Good.
Dr. Richard was selected for the Blue Cross and Blue Shield of Alabama Medical Scholarship Program. Blue Cross pays for her last 2 years of medical school, and in return, she practices primary care in a rural area of Alabama for 3 years.
I'm certainly glad that Dr. Whitney Richard has decided to come back to Enterprise, and we welcome her with open arms. And I hope that our citizens take the time to get to know her. I hope they don't have to necessarily visit her for necessarily all bad things, but healthcare does not necessarily mean just the worst things. It's just quality checkups and things of that nature, and that she wants to give that to our citizens. We thank her very much for that.
Dr. Richards says she's thankful to Blue Cross for the Medical Scholarship Program, a program that removes financial worries and lets her focus on what's really important.
Not having that extra stress, it allows you to take your time with your patients and see your patients and really listen to them. You don't have to worry about, am I seeing enough patients to make the money to pay off all this debt? It relieves all that stress. So I feel like it really does allow us to give better patient care, so that we can get, these patients taken care of the way that they need to be.
I will close by saying this, and I'll get personal as I normally do. To whom much is given, much is required. We have the privilege of serving over 2 million Alabamians. We do not take that for granted. It is a blessing and a privilege to do so. We understand our role and responsibility in the community and giving back to the community. And these programs and others that we fund and contribute to is part of the fabric of who we are as an organization. Do we do everything perfect? No, we recognize that. But every opportunity, as your dad just shared, as being a card holder and having an issue and calling, and we took care of that responsibility. We have those opportunities every single day. And through our provider partners and our group partners, we relish the opportunity to serve the citizens of Alabama and our members who are represented all across the country, but there's an opportunity for us to continue to do better. And we commit to this organization and to the community that we will always be a good corporate citizen, providing healthcare where it's needed throughout the state. And if there's anything we can do to help in the process, do not ever hesitate to let us know. Thanks for the opportunity to be with you today. And I think we may have 1 minute for a question. Oh my goodness, the time is up. Look at that. You can take that. JW said I am required to take a question or two. In the back. Victor, yes, sir. So customer service, they are the face of our organization. We are an organization that prides ourselves in the opportunity to serve. One of my other, get personal again. My philosophy in life is the greatest among you is the one who's willing to serve. And we do not take service for granted in our organization. It is critically important to our success. The only interaction some of our customers may have with us is they're speaking to a customer service representative. Our customer service representatives understand that and recognize how critically important they are to the organization. We recognize that, and we celebrate them every opportunity we have to let them know how critically important they are to the organization. Yes, sir, my Leadership Alabama classmate.
Thanks for being with us, and thanks for all the things you do for this community. We learned from the pandemic the importance of a good public health system, yet we've got a couple of counties in Alabama that don't have a county health department. That makes it difficult for things like testing and vaccine administration. In the last decade, 7 or 8, even though the number of rural hospitals closed, we've got a lot of more than an hour away from prenatal care, delivery services. A lot of physicians and healthcare administrators say we need to expand Medicaid. You got any thoughts about the larger health system in Alabama?
Wow, that's an easy one. I'll say that we have opportunities within our state just as other states have opportunities. And what our philosophy is, wherever healthcare is delivered in the state, we want to be there. We want to be helping and contributing to the delivery of healthcare, wherever that is. We understand the plight of rural hospitals and physicians as we are investing in programs in certain communities. We are deemed an underserved, I think 57 or 58 of our, or 59 of our 67 counties are deemed medically underserved. So there continues to be many, many opportunities for enhancing our healthcare delivery system. One misnomer, well, one thing about rural hospitals, Blue Cross represents about 7 to 12% of the rural hospital's revenue. The majority of that is Medicaid and Medicare. So it's an interesting dynamic. We recognize the opportunities there, and we have told the state, and we signal to the state, and we signal to our provider partners, whatever we can do to help, we're going to be there to help. We offered telehealth services during the pandemic. Probably pre-pandemic, we were averaging about 2,500 telehealth visits. At the height of the pandemic, we were averaging about 80,000 telehealth visits because we opened it up to all of our providers to give them an opportunity to serve their patients. We've tried to continue to be a partner in that space, and we will continue to do so in the future.
Thank you, Tim.
And I think I'm getting the hook. So thank you very much.